Okay, so I want to start at kind of the beginning because I think understanding long COVID is really important. I think that so many people can't figure out why they feel bad and haven't tied it back to actually getting sick with COVID. Also, some people have no idea that they even got COVID because many people get it but don't have any symptoms. So I encounter this all the time. People say, I don't feel well, I'm dizzy, I have headaches, I've got migraines, I can't remember anything, I'm dying out in the afternoons, I'm not sleeping well, I don't wake up feeling rested, I'm emotional, I've got this background anxiety going, I've got body pain, I'm having injuries that I've never had before, muscle cramps, weight gain, problems with hair loss, I have these weird skin patches. I will tell you, I've had most of these symptoms and I couldn't figure it out either. I just knew that something was wrong, and I knew that it stemmed from the fact that I had COVID and then I got worse. So if you're experiencing any of those symptoms, it might be time for you to detox your body and figure out let us help you figure out how to get it out of your body. The people that seem to be most at risk, in my opinion, after working with hundreds of patients through this long COVID protocol, are people that have had viral illnesses in the past or autoimmune disorders in the past, Epstein-Barr virus, herpes zoster, shingles. If you've had some of these problems in the past, even if you're not currently or you weren't currently having any symptoms or problems associated with it, or it had not reared its ugly head in many, many years, it can come back and be very alive and well once you get COVID. And for lack of better descriptions, I guess I'm going to just say that when you get COVID, and sometimes it doesn't even have to be COVID, it could just be a very intense viral illness. When you get sick, sometimes what happens is that your immune system becomes locked up. When your immune system becomes locked up, the ability for your body to attack and arrest the invaders becomes compromised, which means then you stay in an inflammation state and you don't move through the normal process of healing. And this is what we're seeing with long COVID, is people getting stuck in a state of symptoms, and they can't move through it. They cannot get out of inflammation. And we're seeing hormone problems, we're seeing depression issues, serious problems with people gaining weight, which a lot of times is hormone driven. And so we developed a protocol early last year that treats long COVID. And we started seeing patients with televisits and having tremendous success at getting the symptoms under control. But there was about 20% of the patients that didn't get better. And those patients, we really went to work at looking at their autoimmune levels, looking at other things like, is there mold in their system? Is there problems with other contaminants or toxins that are keeping them from getting better, getting through the inflammation state to the healing state? And so that protocol, the oral, or we call it an oral long COVID protocol, has been very successful. We've treated hundreds of patients that really have gotten back to where they were before they got sick. And I'm really proud of that protocol. But now we actually are getting ready to launch a protocol that is a very intense IV nutrient protocol that's about 7 days long. And it will treat patients that have very severe symptoms, have problems with autoimmune disorders, problems with long COVID that they cannot move through it. And I'm really proud to be able to bring that service to our patients, not only at OnePeak Medical, but other people in the community. I think this is very much needed and will provide a wonderful service for our patients. If you are experiencing long COVID symptoms and you want help, if you've not been able to move through it, getting back to where you were before you got sick, no matter how you got sick, and if you're experiencing even one of these symptoms that won't go away, don't sit on it. Think about having a consult. think about calling OnePeak Medical. You could book with me personally over the next 60 days. I will get this lined out for you and really take a good history, put you through some testing and figure out what's going on. Again, that's onepeakmedical.com. Like I said, I just want to open my schedule for 60 days to get some people some help. I probably get 15 to 20 emails a week from people who are very sick, and I want to be able to be of service to you and get you on the right path for wellness.